forgot to turn the recording back on. So ergonomics is what's going to protect you in the life and career of dental hygiene. So ergonomics is an applied science concerned with the fit between people and technological tools and the environment, right? This is a good definition that is probably going to be on some sort of a test at some point in time. It might be on your boards if I don't ask it, but know what ergonomics is. It focuses on making tasks comfortable and efficient for you, the user. So the equipment needs to fit you, the user, instead of forcing the user to fit the equipment. And that's what we used to do. We used to accommodate the equipment. So efficiency makes our tasks easier to do, and in the long run, prevents damage. So worker comfort, productivity, and workplace safety can all suffer if our ergonomics is poor. For the dental hygienist, the work environment includes the dental office layout, the dental equipment, as well as the instruments you're using. So dentists and dental hygienists are exposed to ergonomic risk factors that can lead to discomfort, pain, and possibly disability. I can't tell you the number of my colleagues that have had to leave the profession early on in their career because of damage that's been done to them. So we harp on you with ergonomics. If you're slouching, if you're not sitting properly, if you're having to reach too far for certain things, it can really play a toll after a while. So let's talk just a little bit about musculoskeletal disorders. You need to know what some of the common disorders are for dental health care providers. Dental hygienists are more at risk than dentists for some of these because we talk about repetitive. We're doing the same thing with the same instruments every patient versus a dentist might be using, you know, high-speed handpiece here, or might be using something else here, might be using something else there. Jonathan, you've got a question.
Yeah, I can't see your PowerPoint slides changing.
Oh, wait a minute. Was everybody else just listening to me yak?
Yes.
Yes.
Can you see it now?
Yes.
Yes.
Okay, well, let me go back. You didn't miss anything. Ergonomics, okay? The definition. This is in Canvas, so I just want you to kind of listen to this. You don't need to be taking notes, or you can have your book open and highlight certain things or make notes in your book. All right, so we are going to really work on making sure that your body is protected for as long as you want to be working in dental hygiene. Okay, I love this profession, and I graduated before some of your parents were even born. Oh. Musculoskeletal Disorder, MSD, we have to have acronyms for everything, is a condition where parts of the musculoskeletal system, your muscles, your tendons, your nerves, are injured over time. What are some of the causes? Awkward postures. Periodontal instrumentation involves forceful movements combined with awkward postures. Dental assistants think, oh, this looks easy. All they're doing is sitting down talking to their patients for an hour. It is a physical job. Injuries occur from the overuse of these small muscles and tight grips with our instruments. So injury to the musculoskeletal system can cause loss of strength, impairment of motor control, tingling, numbness, as well as pain. Poor posture. Okay, we're going to get into this on Monday. A twisted torso or uneven shoulders for an extended period of time can increase the risk of musculoskeletal injury. Okay, you want a nice straight back, repetitive movements. The human body wasn't designed to make the same movements hour after hour, day after day. And guess what we're doing in dental hygiene? hour after hour and day after day. So dental work requires repeated use of arms, hands in a fixed working position. So some of the reasons that we get damage: awkward postures, fixed working positions, okay, we don't move. The force, we're actually using strength behind us to take that calculus off the root, and repetitive movements. We're doing it all. So awkward postures, we're talking about neutral posture, neutral position, and that means that the joint is being used near the middle of the full range of motion. So you need to know that terminology, neutral position. The further you are from that neutral posture, it puts more of the strain on the joints. So we're going to talk about our arms. You know, we don't want these wings flapping in the air. We want them down towards your side, okay? Neutral posture. Neutral posture of the wrist, okay? We don't want to be flexed too much in one way or the other, too much up or too much down. We want to try and maintain a straight wrist, okay? Neutral position, because that gives us the strength and it's not doing any undue harm to our muscles and tendons. We stay in the same position, and maintaining the body in one fixed position for an extended period of time is not good, because we're not designed to just sit there. Those of us that have been sitting in front of a computer since COVID. Static gripping of instruments as well. It's recommended now that we change what we do and how we do it and when we do it throughout an appointment, so that we're not so static. Force refers to the amount of effort created by the muscles and the amount of pressure placed on a body part. So we do something called pinch gripping, and that's when you've got your instrument or your pencil in your hand. How are you grasping that? Is it with a death grip, or is it just a light grip? Okay. We do repetitive movements, and that's the task that involves the same fundamental movement for more than 50% of the work cycle. Guess what we're doing, folks? The same movement, rocking and rolling with our instrument. So periodontal instrumentation would definitely be categorized as a repetitive task. And you want to consider the frequency, the duration, and the recovery time during those work tasks. So sometimes you have to put the instrument down and just kind of flex a little bit, or stand up for a second if you're doing root debridement and you're really working hard on a particular patient. There's something called thoracic outlet syndrome. Now, you're going to be getting test questions on this in Navigate as well. Thoracic outlet syndrome. Okay, it's a painful disorder of the fingers, hands, and or wrist caused by the compression of the brachial nerve plexus and vessels. So look at where that brachial nerve plexus is. It's at the base of the neck. So you can see that it's just going all the way down the arm and up the neck. That can hurt. You can have tilting of the forehead. Okay, think about how you would be sitting trying to access a patient. We like to cock our head. If you're right-handed, and I didn't ask if anybody was a lefty, but if we cock our head generally to the right, and we bend to the right, and we hunch our shoulders forward, and we're continually reaching overhead. We're reaching for the light. We're reaching for the bracket table where the instruments are. Static. Rotator cuff tendinitis. It's painful inflammation of the muscle tendons in the shoulder area. This, ladies and gentlemen, hurts like a son of a gun. Ask me how I know. Rotator cuff. You usually hear about rotator cuff from tennis players. Holding the elbow. What causes it? Holding the elbow above waist level. Holding the upper arm too far away from the body. Again, these aren't neutral postures. Pronator syndrome, a painful disorder of the wrist and hand caused by compression of the median nerve by the pronator muscle. Again, remember, if your wrist is flexed too high up or too far down and it's not maintained nice and straight, you can have pronator syndrome. And that's holding your lower arm away from your torso of the body. So again, the ergonomics of patient operator positioning. We're going to be starting with that. We're going to be showing you how to use the saddle, how to use a regular operating stool. Extensor wad strain is a painful disorder of the fingers as a result of injury of the extensor muscles. Extensor wad strain, extensor muscles. It's extending, extending the fingers independently of each other. So what you're doing is you're using your fingers to do your instrumentation, and you're not using your whole shoulder arm musculature. Carpal tunnel is very common, and that's caused by compression of the medial nerve of the wrist. And that's from repeatedly bending the hand up and down and from side to side, and also from pinch gripping an instrument without resting the muscles. You have to give your hand a rest. Before dental hygiene, the #1 carpal tunnel person was the checkout clerk at the grocery store, because they were taking the items and swinging their wrist to bring it. And you can't see me, but I'm swinging my wrist, putting it down the, whatever that elevator thing is, okay? Ulnar nerve entrapment. The ulnar nerve, caused from repeatedly bending the hand up and down and from side to side. Same thing with carpal tunnel, holding the little finger at full span away from the hand. So we're going to be talking about the modified pen grasp. All right, Tenosynovitis, okay? Anything that ends in itis is inflammation of. So that's a painful inflammation of the tendons from the side of the wrist and the base of the thumb. This is what I have. From hand twisting, forceful gripping, and bending the hand back and forth, okay, or to the side. Okay, you do that for 40 years every day. Tendinitis, the tendons of the wrist. Okay, repeatedly extending the hand up and down at the wrist. So you're getting the idea that this is repetitive motion. All right, musculoskeletal injuries. A high risk for these injuries occur when repetitive motions are combined with forceful movements, awkward postures, and insufficient recovery time. So let's take a look at some other stuff. Periodontal instrumentation, okay? Anything that you're doing inside the mouth is instrumentation, whether it's holding the mouth mirror or specific instruments, okay? We're calling it periodontal instrumentation, right? So what are some of the skills? Okay, it's really a complex psychomotor skill. It takes repetition for you to get the muscle memory. You're going to feel very awkward sitting and very awkward doing things for the first semester up through next semester. It's very awkward. And then things just kind of click and you get into the motion of things. It's kind of like driving a car. Remember how complex that was when you first learned, and how stressful it was. And now you're doing everything and you're not even thinking about it. And that's what your periodontal instrumentation is going to be by the time you graduate. But it requires proper positioning, instrument grasp, mirror use, finger rest, stroke production. So for successful instrumentation, you have to have mastery of the individual skill components, okay? And they're mastered one by one. So what we do is we break everything down and into little puzzle pieces to make the entire picture. And that's what the beginning of your instrumentation process is going to be. So some ergonomics do's and don'ts. Don't alter posture positions just to get the job done. We all do that. Sometimes you have to, okay, especially if you have a patient with special needs in the chair. Do assume a neutral balanced body position. Do make adjustments to the patient's chair and the dental equipment to complete periodontal instrumentation. That patient is only going to be with you for 45 minutes, let's say, or an hour, or in clinic 2.5 hours, right? And they're going to leave. But if you're in that bad position every hour of every day, you're the one that's going to suffer. The patient's going to be okay. They may not like it, but they're going to be okay. So we talk about neutral positioning, and that refers to the ideal positioning of the body in a balanced position, and that results in a decreased risk of musculoskeletal injuries. So what is this neutral position? Okay, let's start with the head. We're starting up on top. The goal for our head is to tilt from 0 to 15 degrees. 15 degrees, my friends, is not very much of a tilt, all right? You want to avoid tipping the head too far or from one side to the other. So just take your head and kind of look down just a little bit. Guess what? That's as far as you can go. If it's anything more than that, you're tilting too much and you're putting a great strain on your neck and your shoulders. Think of your head as a bowling ball, okay? And you need to hold that bowling ball with a nice firm stance. Otherwise, you're going to get tired, okay? If you hold the bowling ball close to you, close to your chest, you're going to be able to hold it a lot longer than if you take that same bowling ball and hold it out away from your body. Your arms are going to get tired. So we have a neutral position with our neck straight. We have a neutral back position where we're leaning from the hips. We're not leaning with the curved back. We're leaning from the hips. All right, 0 to 20 degrees. Not much. You're keeping that torso nice and straight. Yes. Somebody have a question?
Did you just go yesterday?
I'm sorry? The book says 20 degrees. Do you want us to know 15 degrees? Go by what the book says, okay? It's 15 degrees for the head and 20 degrees for the torso, for the bend. All right, we want to keep the back straight and not twisting or leaning. We want our shoulders down. We want them parallel to the floor. We want our hips parallel to the floor. We want our elbows at the waist, at level, held slightly away from the body, okay? We don't want these big bird flappings, okay? Elbows are held just at the waist, just a little bit out. Again, 20 degrees, okay? Forearm posture, parallel to the floor.
Misty, we can't hear you anymore.
I thought it was only me. I was about to freak out. I think it kicked her out.
Yeah, I don't even see her in here anymore.
Yeah, they said Nicole's the host now.
Yeah.
Oh, tight.
She's kicked out?
Yeah, I think it kicked her out. Zoom does that sometimes. Like,
Oh my gosh.
How obnoxious.
I think that she doesn't know. She still keep talking then.
Well,
Oh,
I'm sure
probably.
No, I
Yeah,
think
maybe one of us have to email her and let her know. Otherwise, she will keep
Well-
talking and talking without knowing anything.
Nah, she knows now because she's off.
Oh.
Yeah, she knows now. So Nicole, you probably need to see if she's in the waiting room.
Let her
Yeah.
know.
How do I do that?
Click on participants. It might tell you there.
Oh, okay.
Oh, it looks like she might be back in now.
Oh, thank goodness.
Oh, yeah, there she is.
Too much responsibility for me.
I teach radiation safety on some Saturdays, and the last time I did this, we're virtual now, I lost internet connection. I ended up getting my cell phone out and holding the phone up to my screen so they could hear me. It worked, so that's what I was trying to do, was find it for you. Okay, tell me how far to back up.
The last thing we heard was the forearm position.
Oh. Okay.
Mrs. D, can I ask you a quick question?
No. Yes, you can.
Going back to the question I typed in about the neutral neck position, you said to go with what the book says. It does say 0 to 20, but then you reiterated 0 to 15. So I just want to make sure that that's not, that it is 0 to 20.
Okay, there's not much difference between 15 and 20, and
Right.
if you end up getting a question, guys, I don't want to argue questions with you, but if you end up getting a question that asks 20 and the book says 15 or the slide said 20 or whatever, come to me. We'll make adjustments for it. Okay?
Okay.
I
All right.
want to be
Thank
as
you.
fair as possible. All right. Now, if
Okay, thank you.
yeah, this is, we're not out to get you. Might seem like we are, but okay, neutral hand position, parallel to the floor. The spine has 3 healthy curves. Okay, when you're sitting down, you position your buttocks all the way to the back of the chair. Now, this is with the regular stool. We are not using stools anymore. We're into saddles. So each unit will have a saddle that is available to you. And we're going to work with you on how to find the right saddle for you.
Misty, we can't see your.
Oh, good grief.
PowerPoint.
Okay, hold on. Well, you see a person sitting down in a stool. This is not boding well for me. So we can see that this person is all the way to the back, all right? When you're sitting in an operator, as an operator stool, this is how you should be sitting, all right? Your butt should be all the way back here, and this should give you some lumbar support, all right? But we have saddles in the chair. We're one of the few schools that actually have saddles, and that's the technology that we have today, all right? When you're using a regular chair, you want to seat height, so the feet are flat on the floor. Okay, the feet are flat on the floor. So there's levers there, and there's levers also for the back of the chair. So you want to distribute your weight evenly, and you want the seat back about 1 inch higher than the front seat. So what you want is your hips to be just a little bit higher than your knees. Each clinician needs to adjust the stool height and seat back to your own body proportions. And that's why you're putting barriers on certain areas, because the instructor's going to come and you're going to be, 5'8", and Ms. D's only 5'1", and I'm not going to be able to get on the chair very well, so I have to lower it. So if you've got barriers on there, we can make those adjustments. Neutral position of the patient, all right? You need to know what the supine position is. For maxillary treatment areas, it's the supine position. Look at where the nose is, where the knees are, and where the feet are. Okay, that patient's pretty far back. They're flat. Patients don't like the supine position very much, but for your ergonomics, it allows you to see the maxillary arch. The patient's feet are even with or slightly higher than the nose. If I had COPD or breathing problems, or if I had other situations going on where I couldn't be laid back all the way, you'd have to make accommodations. The chair back is nearly parallel to the floor. Okay, and this is the maxillary treatment areas again. The top of the patient's head is even with the upper edge of the headrest, so they're pushed up here. Okay, you ask them to scoot up. So for the mandibular position, look at the difference between, okay, the maxillary position, very flat, and the mandibular position. So for the mandibular position, you raise the back just a little bit, and you're going to lower the base a little bit. Okay. For the maxillary arch, there's a chin up. You want that maxillary arch to be perpendicular to the floor. Chin up for maxillary arch, chin down for mandibular arch. Chin up, chin down. Patient's moving, or you're adjusting the headrest. Again, this is to help you gain access. Neutral positioning of the equipment, you want your light to be a comfortable length away. When you have loupes as well as a headlight, you don't necessarily need this lamp here. I have worked for so many years with that lamp that it's just automatically my arm goes up to reach for it, even though I got a headlight on and I don't need it. I still reach for it. Muscle memory. Okay, so you've got a little bit of wiggle room here, okay, and there's a cheat sheet, I call them cheat sheets in Canvas, about patient operator positioning that will let you know chin up, chin down, where the light's supposed to go, okay, it's all on one form. All right, so you are the operator, okay, what position are you supposed to be in? Your upper arms should be parallel to the torso. Your arms are not raised, the shoulders are relaxed and parallel to the floor. Your hips are parallel to the floor. These are the bird wings here. Can you see how far those elbows are extended from the patient? The chair of this is too high. They're having to lift their arms up and they're having to wing their arms out. The patient is not positioned well, but look at the clinician. There's nothing that looks comfortable there. She's hunched over. Her feet are not flat on the ground. Her elbows and wrists are not parallel to the floor. So, easy neutral position. You're going to be practicing this on Monday. You sit alongside the patient. You position your arm against the side. You position your arm across your waist. So you're kind of looking, where is your elbow and your arm in relation to the operator field? You lower the patient's chair until the patient's mouth is open just below the point of your elbow. Again, you want to check yourself. And that's what we will be doing as faculty. We'll be taking pictures of you and yelling at you with love in our hearts. So you ask the patient to adjust their head, move towards me, move away from me, chin up, chin down, so you can gain better access. And you want to look to see where your equipment is. What we're doing now is standard equipment is wearing magnification loupes, which helps our posture, and having illumination, which really focuses the light. Spectacle mounted or headband mounted lights are now standard operating procedure. It's not mandatory equipment. Some dental hygiene schools are putting that as part of their instrument kit. We are not. but you want the light beam parallel to the clinician's line of vision. So magnification is really great because it magnifies the treatment area, it improves visual sharpness, but with the magnification, we need more light, and it reduces the strain of the back and the shoulders because it's keeping us in alignment. If we bend too far forward or too far away, then we're going to be out of focus. So it decreases eye strain overall. The field of vision without loupes, we have a tendency to want to try and crawl inside the patient's mouth to see more than what we can see. So we're going to be talking a lot about this neutral positioning. It's critical for your longevity as a clinician. Any questions on that? Okay, now let me see if I can find number 2. This is just thrilling stuff, isn't it? I know you're thrilled.
Misty, did you say there was a time we would be purchasing those loupes?
Yeah, I usually bring 3 different companies in, and so they can tell you about their product, their warranties, and you get to try everything on. But now with COVID, we're going to have to do things a little under the radar.
Okay.
So we'll be having the companies do a Zoom presentation for you, and then we'll arrange some sort of a time to be able to have you see their product. I used to have what's called a loop day, where all the 3 vendors would come in and you'd get to see all 3 of them at once, but we can't do that anymore. So I'm trying to work something out.
Misty,
Yes.
I have a question. So I have a loop. The doctor that I work with wanted me to wear one, so I have mine.
Good.
Am I able to use that? Or,
Not yet.
like when we're required to, or do I?
Well, you're never going to be required to, but once we get past patient operator positioning and periodontal probing, once you get the idea of where your hands need to go and your fingers need to go, you can start using your loupes. Right now, we're looking at the big picture. You're going to be looking at the entire patient. You're going to be looking at you. You're going to be looking at your shoulders and your wrists and that type of thing. So the loupes aren't designed for that. It's to be focused on the mouth itself.
Got it. Thank you.
Okay. Patient operator positioning, clinician position. Okay, we use a clock. Okay, when we're talking about patient operator positioning, all right, we use an analog clock with the face as a guide. So you need to know what the clock positions are. So if you don't know how to read an analog clock, you got to learn. All right, the patient's head is the 12 o'clock position, and the patient's feet are at the 6 o'clock position. So instrumentation is going to be around the clock. For right-handed clinicians, we sit anywhere from 8 o'clock to 1 o'clock. For lefties, they are on the other side of the patient, 11 o'clock to 4 o'clock. Do I have any lefties in this class?
Me, I'm a lefty, Misty.
Okay, well, we are going to try and keep you then. You will be matched, excuse me, I've got the hiccups, with Amanda Saverance, who's a second-year student. She's a lefty too.
Oh, okay.
And lefties are fine. It's just the fact that you have to rearrange the units.
Right. Me and Miss Kane, we tried to rearrange it yesterday to see if it would work. It would, but it's kind of a headache with all the wires.
Yeah. No, excuse me. So there are certain units that work better for lefties than
Right.
others.
I told her I want to stay where I am, but she said, "Oh, well, we'll see."
In my day, and before my day, if you were a lefty, you had to learn hygiene with the right hand because units just weren't set up to be able to be used on the other side. And I apologize for my hiccups here. But so we're going to use the patient. We're going to use our clock positions. All right, if this is 12 o'clock and this is 6 o'clock, this is going to be the 8 o'clock. Does it make sense? 8 o'clock, knees are forward, and you're twisting your back. I don't like the 8 o'clock position. We weren't allowed to use it. We use the 9 o'clock position. Okay, think of your body as a tripod. Your spine is part of that tripod, and then your legs go outward. 9 o'clock position. 10 o'clock position, 12 o'clock position, 1 o'clock position, or 2 o'clock position. When I was in school, we had 9 and 12. Those were the only two positions. So for lefties, it's the same thing, just on the other side. So when you have test questions, the test question, if I've done it right, will say, for the right-handed clinician, you're sitting at this position. For the left-handed clinician, you're sitting at that position. And then it'll ask the question about whatever it is. I hope I've done that with all of them. Occasionally a student will catch me, but it's just on the other side of the clock. All right, so we have sextants. We divide the mouth up into sextants or quadrants. All right, so we're dividing the mouth up into midlines, the center where your nose is. Okay, anterior teeth and posterior teeth. Your anterior teeth are your front teeth. Posterior teeth are your back teeth. When we have a midline, you have surfaces towards the clinician and surfaces away from the clinician. And I don't expect you to know this now, so don't freak out, guys, all right? But when you have a mirror in your hand, it'll make more sense. The anterior surfaces for the right-handed person, all right, they're shaded. The clinician's seated over here where the handle of the mirror is. So these surfaces are towards the clinician. The unshaded areas are away from the clinician and away from the clinician. They always want you to look at me, my patient, my light, my non-dominant hand, and my dominant hand. So for the lefty, it's just the opposite. For posterior sextants, right, I'm not going to harp on this, guys, because we are going to go over this in clinic. And when we do, have your book available to you because it will show you where you're supposed to sit for what positions. Posterior teeth are the back teeth. When do you sit in the 9 o'clock position? When do you not sit in the 9 o'clock position? When do you sit in the 10 o'clock position? Okay, so it goes over right and left-handed. So you can see how this textbook, the spiral book, is really going to help you in clinic. So we always want you to have this with you. Standing up, this is one thing I did not learn how to do when I was in school. I did not learn how to stand, and my first patient in private practice was in a wheelchair and I had to stand. I didn't know what to do. My body was hurting by the time I was done. So it's good to know how to stand. You're going to have many patients that can't be leaned all the way back, and we're going to help you with that. Analyze the positions, okay? So let's take a look at this. How is that patient seated or leaned back? Is this a supine position?
Maxillary.
that would be, okay, for a maxillary position, you want supine position, but look at where her nose is. Where would her feet be? Okay, her nose is not going to be at or below feet level. You can see that her chin is tilted down just a little bit, and the back is up just a little bit. So this, I would say, is a mandibular arch position. This is where most clinicians work all the time. We slip the patient back, we keep them there, and then we just ask for their head up or their head down, chin up, chin down. But for true supine, this back should be completely parallel to the floor. Okay, again, mandibular, a little bit higher. This is how I would like to work standing up. What's wrong with this person, the clinician?
The arms.
Exactly, their arms, flapping like a bird. This is what happens when you go into an 8 o'clock position, the tendency to twist the back like this. So I don't like the 8 o'clock position. That's the twist. And this is just wrong on all levels. But if you're working in a dental environment and you're walking down the hall, you're going to see all of this. What's wrong with this?
Get her head tilt.
Well,
it's too low.
Her elbows and wrists are really parallel, so they might be just a little bit too low, but her back is in a neutral position. Her head is only tilted maybe 10 degrees. So this actually looks pretty good. She's in the 12 o'clock position. I would say that she's just a little bit too low. Do you need to know if this is wrong or right?
No.
It's wrong. Same way, it's wrong. Okay. Guys, it is 2:10, and I've gone over the Gehrig chapters. What I'd like to do is pause for now and email you the link that Linda Albowitz has sent. I'll email that. It's another Zoom link, and that will get you time to also get your kit out from Hugh Freedy, and she's going to do the Hugh Freedy kit. I, ladies and gentlemen, will be emailing you more, so please keep track of your emails once I get Navigate up and running, and I believe it's going to be, the test will be on chapters 1, 2, 3, and 6. On Monday. Are there any questions?
For Monday, do you want us
I mean,
to?
I don't have to say, like, I won't submit this today.
Okay, I was hearing a lot of background. So what was the question again?
Okay, so for Monday, do you want us to read 1, 2, 3, 6, and then also 10, 11, and 12 for the Wilkins?
Yes, because we will be demonstrating, we'll be going over medical history. We will be going over vital signs and doing blood pressure. So you need to know where the brachial pulse is, where the radial pulse is, and how to do that.
Okay, and the exam for next week is going to be on Tuesday, right?
Tuesday, yes, and I'll have it open all day.
Okay, thank you.
Okay. How long is the meeting will last with Hugh Freedy? I don't know. Count for an hour. If you need to leave, you need to leave. Okay, this is, if you need to leave, you need to leave. The test is going to be on Tuesdays. I made the mistake of putting everything on Mondays at first because this is the first time I've ever had a lecture for this class on a Tuesday. So anyway, that's my fault. Tuesday is your 141 lecture day. So please, if you see all these discrepancies or whatever, or have confusion, email me because I am just as confused as you are.
And then you said that we're going to be doing that quiz after lecture on Tuesday?
What quiz?
Or the tests or the
The
quiz?
exam? It'll be open all day. So if you want to do it during lunch hour, you can.
Okay. Okay. Alrighty.
But
If you want to do it
Mrs.
after, if you want to do it after lecture, you can. But
Okay.
it's open book, so I want you to have the time to be able to not stress about it.
Okay. And then for the
But it will be timed.
It'll be timed, but I'll give you like an hour and a half or something.
Okay, and then do we also have the quiz that's due before next Tuesday, correct?
I
So-
only have one set up yet. I'm going to be flexible with this, you know, so if I need to give it the first couple of weeks, if I need to open end them for 3 weeks, I'll open end them for 3 weeks. I don't want to panic everybody. This is hard enough trying to get into the routine.
Right. So, and are the quizzes that are due before each Tuesday, are those open, no open book?
Absolutely.
Okay.
I have a question too. Will you let us know each week what chapters exactly we're supposed to be reading? I was just going through the lecture lab reading assignments, and on certain weeks, the chapter numbers are repeating, and then also, but it will have a different title name. So I was confused on
okay.
that.
Could if you find, who am I talking with? Is this Michaela?
Yeah, it's Michaela.
Okay, if you find that, could you let me know, because it could be my proofing that
Okay.
I didn't transfer something. I hate using new books.
Okay, that sounds good. I'll email you.
Thank you.
Okay.
Thank you. So it'll all be ready for next year by the time you get done. Okay, so let's, you email me if you've got any issues. I will be on campus tomorrow for most of the day as well. When you're in radiology lab, you can ask me any questions. I will be doing local anesthesia lab, but there'll be some downtime for me as well. So I've enjoyed this.
Miss D, just want to clarify one more time about the first test. So you said that the first test would be on Tuesday, take home and open book, open note test. So can I take it home or I have to take it in school?
No, you'll take it at home.
Okay.
Yeah, everything's going to be done at home.
All right. Thank you very much.
Oh, you're welcome. You're welcome. Okay, be on the lookout for an email from me, guys.